Luke has alluded to some of the work that we have done together, and I'm going to be talking a little bit more about that. Centre for Information Design Research is kind of a peculiar department, which mini research centre within the Department of Typography and Graphic Communication, which is a design department. I'm a psychologist by training, and I've always done work on how people use information. So why is information and the design of information important in dementia care? Well, it is a good thing. Information is the basis for action. But if you look at the way some information is presented to patients in some circumstances, it's actually very difficult for them to use. So this is just an example of an EpiPen with pretty typical patient information leaflet. It ticks all the boxes in terms of regulations for information, and it will have been tested in some ways, but if you look at it, you wonder why the pictures are so small, why they're on a grey background, why the headings are also similarly on a grey background, and so on and so forth. And I could go on and on about the detail of the design. But it's not only the detail, it's the fact that these things are often ignored completely, especially with very intuitive looking products. And we did a little bit of very informal research with people who used EpiPens or had them for their children, found that after their first consultation with the doctor and the prescription of an EpiPen, they very rarely or almost never looked at the instructions for how to use it. So I asked a couple of students just to do, this is part of their MA project, course, to do a final year project on getting between the user and the device. And I'm sorry, these aren't great photos of their project work, but just thought it'd be interesting to show you a couple of alternative approaches. So the one on the left is still a pretty straight patient information leaflet, but the student has paid a lot of attention to the clarity of the diagrams and the wording that goes with them, and produced a little wallet card to go to accompany the user all the time, because patient information leaflets very rarely go with the patient and the device that they're using. The student on the right took a much more radical approach and said, well, I'm going to make the information as important as the product. And so he produced this large sort of fanfold or fan information leaflet, which is very eye-catching and might at least attract the patients to look a little bit longer than they would with a conventional patient information leaflet. So I'm not going to go on very much more about those, but just to say this is the sort of approach that we take to the design of information in care settings, and ensuring that the information is designed in the best possible way to influence behaviour, to help people make the right decisions. So I have three projects which I'm going to race through, all carried out with Luke, and a cast of many people, both within the Royal Berks and Berkshire Healthcare Foundation Trust. The first one, which Luke showed you a little preview on, is to do with including carers in pain assessment in hospitals. At the moment, when people come into the Royal Berks, they are assessed using the Abbey Pain Scale. Their level of pain is assessed using the Abbey Pain Scale, as in many other hospitals. But the problem with patients with dementia is that they have problems expressing their experience of pain, and symptoms of dementia may be confused for symptoms of pain, or vice versa. Symptoms of pain may be attributed to dementia. So the idea with this project was to get input from the carers, the relatives of people with dementia, and we developed first of all a very friendly A5 leaflet, 8-page leaflet, which, as you can see on the top right, people enjoyed filling in and filled in very effectively, and we thought would be a good thing. And then we trialled it on the wards, and we found that it just didn't fit at all into ward process, and I think we eventually trialled about 200 and got 25 completed leaflets back. So we regrouped and we looked at another approach, which is to design, as you see at the bottom, a combined form for carers and for the first professional use of the Abbey Pain Scale. We haven't trialled that yet, but we're hoping that that will be more effective in bringing carers response and information about how a patient expresses pain into the care process, and improving communication between the carer and the hospital staff. Our project on reporting assessments of capacity is a project that's still in its rather early stages, so I won't go into it in great detail, but the issues there are that assessment of capacity, which is an essential part of care of people with dementia, are generally carried out by psychiatrists or geriatricians, but in fact they could be carried out by a very wide range of people involved in care, who are often resistant to do so, and may report, even if they do these assessments, in very different ways. So the idea was to develop a way of reporting assessment of capacity which would have some consistency and also help communicate across the team what had been done and the outcome of an assessment. After a series of interviews with professionals, some of whom are sitting in this audience, we realised that people don't want a form, so what we produced was a form that isn't a form, really, a very simple layout, which we're currently getting feedback on. And while this was going on in the development of a paper form, I got another student to have a look at how electronic media might be used in assessing capacity, and the use of, for example, phones with their facility for voice input, and which might be useful for somebody carrying out an assessment to record quick notes while the assessment is taking place. Finally, our third project, which is our only funded project so far, is again a response to the National Dementia Strategy of 2009, and the realisation and the promotion of the family carer as an important part of dementia care. And that's certainly recognised, and family carers receive all sorts of information, the kind that you receive, that you can see in this picture here. And when you show this slide to carers of people with dementia, they all sort of groan and say, yes, we've got all that information now what do we do? So the aim of the project is to produce a very focused route through the information that carers of people with dementia will need. It's going to be called, or it's called at the moment, the Berkshire Blue Book, to sort of reflect that red book that you get after a child has been born and takes you all the way through the early years of your child's life, to support carers and patients. It's being designed with input from the carers themselves and from professionals involved in dementia care. And we are in the process of setting up the structure to be able to evaluate the impact of the new information when it is finally produced in 2014 on carers' understanding of dementia and their feelings of ability to cope. We are dealing with a quite difficult situation where people actually, when they're overwhelmed by caring for their relative, and they don't really have very much time to study information. Just wanted to end very quickly, I may offend too, with a project that we carried out for National Offender Management Services in 2011, which has been rather a successful project. I just wanted to show how these very small projects can grow. They came to us very inspired by a anaesthetist called Jasmeet Soor at North Bristol NHS Trust, who was using checklists to improve communication in operating theatres, and they wanted to use a checklist of some kind to improve communication between prisoners and staff and de-escalate violence when prisoners made requests. So we developed this tool called Recode, which has two different versions, parallel versions, depending on whether you're a prisoner or a member of staff. But the idea is that if a request is made, it is acknowledged by the officer, and then a process of negotiation goes and the officer decides. And it's been trialled in a couple of prisons and very effectively reduced instances of violence. Effectively, not dramatically, but enough to be taken seriously. And it's being rolled out nationally. So I just wanted to leave on that high note to show you that there are situations where information design can have an impact on outcomes, to thank you and to just mention that you all have, I think, one of these, and if that you think sometime during this evening or at any point later of some information design may have an impact on the processes of care that you're involved in, do let us know. Lots of access routes on there, and we'll look forward to hearing and maybe developing a research project together. Thank you.